Hi there, I'm Danielle Roberts, Medicare expert and co-founder here at Boomer Benefits. When we started this company, we had one clear goal: to be the agency in the Medicare industry that was known for its 5-star service. That's why every policyholder who enrolls through us receives our free lifetime client service. This is ongoing support for Medicare-related issues for as long as you have your policy with us. Our dedicated client service team, or CST for short, is made up of knowledgeable Medicare specialists whose primary goal is to answer your questions and get problems resolved quickly. Think of them as your Medicare advocates. Whether it's sorting out billing issues, contacting your insurance carrier, or helping you understand a confusing invoice or Medicare summary notice, they're here to help and to step in on your behalf. But it's not just about troubleshooting. The CST can also help with things like rate shopping your Medigap plan, reviewing your coverage if you move to a new state, and making sure your benefits are still the right fit as your needs change over time. If you're thinking about choosing Boomer Benefits as your Medicare insurance broker, here are 12 reasons why we're confident you'll love working with our client service team. Number 1, we won't let you pay bills that you don't owe. Medical billing can be confusing, especially when Medicare and other coverage overlap. If you've recently retired, for example, it can take time for Medicare to update your status from secondary to primary payer. That gap in the system can result in you getting bills that shouldn't be your responsibility. And that's where our team steps in. If you ever receive a bill that just doesn't quite look right, send it over to us. Our claims experts, who have already saved our clients over $6 million in billing errors, will investigate. We'll work directly with your doctor's office, billing department, and the insurance carrier to get to the bottom of it. If the bill is correct, we'll explain why and let you know that it's okay to go ahead and pay it. But if there's an error, we'll request that your provider do a code review, and once it is properly recoded, also resubmitted for payment. You do not have to do it alone. Number 2, we will help you get claims resubmitted and follow through. Sometimes a bill is denied or paid incorrectly, even though the services are supposed to be covered. Our team knows the ins and outs of Medicare claims and will take the reins to make sure any eligible claim gets reprocessed. We'll contact Medicare, your Medigap company, or any other responsible party to request a proper review and resubmission. Then we follow up, because we know your time is valuable and you shouldn't have to chase down multiple departments just to get a claim paid. Number 3, we help you get reimbursed for bills that you shouldn't have paid. Let's say you paid a bill upfront. Maybe your doctor collected the Part B deductible at your visit, but you later find out you weren't responsible for it. This happens more often than you might think. For example, if you pay that Part B deductible before Medicare processes the claim, Medicare has no way of knowing it's already been met. So they apply it to a different bill, and now you have a provider charging you for a deductible that you already paid to another provider. When that happens, our client service team will contact the provider that charged you up front, explain the situation, and request a refund on your behalf. We'll also follow up to make sure the money is actually sent back to you. No long phone calls or paperwork on your end, just peace of mind knowing that we're on it. Number 4, we guide you through appeals if a carrier declines your application. Outside your one-time Medigap open enrollment period, many carriers require you to answer medical questions when applying for Medigap coverage in many states. If you have certain health conditions or a complex prescription history, the company might decline your application, but its denial isn't always the end of the road. You have the right to appeal, and our team can assess your chances to help you decide if an appeal is warranted or if the plan's denial has a decent chance of being overturned. If so, we'll walk you through the appeal process step by step and help you craft a strong case to give you the best possible chance of approval. There's no guarantee here, but it's good to have someone on your side that is familiar with the process to guide you along the way. Number 5, we help you keep informed about important Medicare rules. Medicare isn't one size fits all, and in some states, there are unique opportunities to switch plans without going through underwriting. Take California, for example. Every year, you can switch Medigap plans without answering health questions around your birthday month. If you're a Boomer Benefits client, our team will help to make sure you're aware of opportunities like this so that you never miss a chance to save money or get better coverage. Number 6, we rate shop for you to help you save money on premiums. Medigap premiums can go up over time, and when they do, we're already on it. Some carriers alert us to your rate increase in advance. In those cases, we'll reach out to you proactively to discuss your options. But even if your carrier doesn't give us a heads up, all you have to do is give us a call. We'll compare your current plan with other options that offer the same benefits, and we can let you know if switching could save you money. And we don't just do this once. You can call us at any time, year after year, and we'll reshop your rates as often as you'd like. Number 7, we help you make the most of your golden ticket enrollment window. When you first enroll in Medicare Part B, usually at age 65, sometimes later, you get a one-time 6-month window to buy a Medigap plan with no health questions asked. And we call this your golden ticket because it gives you access to the very best coverage without worrying about medical underwriting. Our team will help you apply and can assist if you change your mind and want to switch plans during that window. And if you qualified for Medicare early due to disability, we'll remind you that you get another open enrollment period at 65, a second chance to get a Medigap plan without medical questions. We'll even put a note in our system to follow up with you and help you make the switch at the right time. Number 8, we confirm your doctors are in the network before you enroll in an Advantage plan. When you're shopping for a Medicare Advantage plan, network restrictions really matter. If your favorite doctors aren't in the network, you might end up paying more or not being able to see them at all. And that's why our team checks every provider you care about before you enroll in any new plan. Whether you have just one primary care doctor or a whole team of specialists, we'll do the legwork to confirm who participates in each plan's network so that you can enroll with confidence. Number 9, we make Medicare easy to understand. Medicare comes with a whole lot of moving parts, deductibles, copays, coverage limits, and rules that vary depending on your plan and your state. It's easy to feel overwhelmed trying to understand what's covered and what you might have to pay out of pocket. Our team breaks it all down for you in clear, easy to understand terms. We'll walk you through your benefits, help you understand how your plan works in real life, and make sure that you're confident about what to expect at the doctor's office or the pharmacy. No jargon, no confusion, just real answers when you need them. Number 10, we help you navigate Part D and pharmacy issues. Part D drug plans can be super confusing. Many of our policyholders tell us that just having someone to call whenever you have a question about how Part D plans work is a great benefit in itself. Our client service team will walk you through your plan's drug tiers, verify copays, and help facilitate prior authorizations when required. We'll even contact your doctor's office to make sure they submit the right forms so you can get your medications filled as quickly as possible. Number 11, we help you prove creditable coverage to avoid late penalties. If you delayed enrolling in Medicare because you were still working past age 65, you'll need to prove that your employer coverage was creditable to avoid penalties. But many people don't know to save those records, and gathering the paperwork later on can be overwhelming, and that's why we're here. Our team will help you collect the right documents and guide you through the process of submitting them to Medicare so your enrollment goes smoothly and you avoid any costly surprises. Number 12, we help you update your plan when you move. When someone moves to another state while on Medicare, the move can sometimes be a little complicated. Some policies, like Medicare Advantage plans and Part D plans, are specific to the area or state in which you live. You will most likely have to change them when you move to a new state. Our CST will do all the heavy lifting with Medicare for you. We will provide guidance and take the necessary actions required to help you change your plan. And we'll also do the research, looking at your coverage options in your new state. We'll give you instructions on how to notify your prior insurance company, Medicare, and Social Security about your move as well. In closing, we set ourselves apart from the rest. Simply enrolling in Medicare is complicated enough, but managing it year after year is a whole nother story. That's why we built our client service team to be your go-to resource for every Medicare need, big or small. It is so rare to find this level of amazing service these days. But don't take our word for it. You can read over 25,000 five-star reviews on our website. And the best part? You pay nothing extra for this service. Your premium stays the same whether you enroll through us or directly through the insurance company. But with Boomer benefits, you get a dedicated team behind you every step of the way. We're proud to offer this level of support, and we'd love the chance to help you too. When you're ready, we'll be here. Watch this next video to learn about applying for Medicare.